What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. In today's X-ray tech video, we are covering the different protocols you'll see between what the ER doctor wants versus what the radiology radiologist expects. So to give you context, I am a night shift X-ray tech, been doing it for about 4 years now, and in X-ray school, we learned that the bare minimum is 2 views, at least bare minimum. And we learned this because you can shoot something, let's say lateral, and then the AP view of whichever bone, you can see completely different stuff, and you can be able to diagnose better, which we don't diagnose, but the radiologist does. And I've recently noticed over working these past years, both nighttime and daytime, that the ER doctors are not all aware, some of them, of what the radiologist wants versus what they actually want, the ER doctors themselves. There have been many times where you can shoot, let's say, just an AP of whatever bone you're shooting, and the ER doctor will be like, okay, we're fine, they'll be fine. And here's the problem: depending on your radiologist, they will send you back to get another image. They'll call you, hey, did you shoot a lateral? Because I can't get a proper diagnose the patient like this. And there's been many times where the ER doctor says one thing and the radiologist will say another thing. So certain situations, especially in the trauma room, maybe you won't be able to get an AP in the lab because there's so much stuff going on, and maybe like patients coding or whatever emergent stuff is going on. So sometimes you just have to document was unable to obtain lateral because whatever, or there's too many people in the room, like for the exposure to be, So there's certain times where you are only able to get one image, but it took so long for me to realize that the ER doctors aren't aware with the radiologists, they're not in the same boat. Because sometimes they'll order stuff and we'll shoot it, and then later on the radiologist in the report will suggest maybe for us to do different type of views or different stuff like that. They put it in the report. But sometimes certain radiologists, especially if they're in-house, they'll call you and be like, hey, you need to do this, or hey, you need to do that. So for me to avoid having any issues with our radiologist, just try to get the AP in the lab. Sometimes obliques aren't able to be done because of the patient isn't capable, and you try to reduce your dosage to yourself by holding the patient to try to get the oblique. I mean, sometimes you can get it by angling the tube, but not always. It's not always the situation. I have noticed that if the patient's bones are pretty bad, it's a bad trauma, and you get what you can, just try to get as many pictures and angles of the tube as you can. Usually they're pretty understanding, because as soon as they see it, they're like, okay, this is probably the best images he could probably acquire. Even the ER doctors sometimes, we'll try our best. We'll do different angles, cross tables, and adjustments, whatever's possible. And usually they're pretty chill. The only thing I've noticed that they've been okay with is post reductions for the shoulder. Usually just a one view will do, because they're trying to, the ER doctors at least, because they're trying to see if the humerus is in the socket. Usually one view will be fine, and then sometimes they'll CAT scan it to make sure that it is in the right spot. Just because if you try to do a Y view, sometimes it'll pop out of place. There's been many times where that's what the ER doctors tells us. If we try to alter the patient right away, sometimes the ball and socket will pop out of place and stuff like that. But yeah, I'm just here educating anyone who wants to know more about this beautiful world of radiology. I make videos on almost every aspect of this beautiful field, because most people on the YouTubes do not. And I mean, the YouTube medical world is filled with a bunch of doctors speaking, or the nurses, which is nothing wrong with that. I just feel like no one is making videos for our people, and I'm here to educate anyone who's listening, because I give you information that I wish that I was a student I learned, and there's some stuff that school does not teach you, and it's more of an on-job training. And especially at nighttime, we deal with different variables that the daytime people don't. So I'm just here giving you some information so you can be better prepared. But yeah, it's my boy Miguel. See you on the next one.